Love to hear from you. Dr. Paul Charlton, I love it. Welcome, Dr. Paul. Also a student, a colleague, and a dear friend. Lovely to see you on the call. Okay, with that being said, we are recording the meeting tonight and we are going to kick it off. So, quick disclaimer. Tonight's conversation is to inspire and to educate. Remember that we all need to circle back to our healthcare provider to make sure we cross our T's and dot our I's and get that proper legal advice. We always have to let people know that because sometimes what you're going to hear is not going to be conventional. But we want to know what else is out there, what information is out there. It's up to you to do your due diligence. So this is not health advice. This is information for you to ponder and for you to get clarity and ask questions around that. So I'm going to kick it off tonight. My name is Diane Solano. I'm an orthomolecular nutritionist. I am passionate about the health and wellness space. I know for a fact that when you keep your body healthy and strong, it works for you to become the best version of yourself. I'm a big student of the health space. Dr. Bob has been my mentor for the last, I'd say 15 years when I first discovered him on the lecture circuit. And I'm so impressed not only with his knowledge, but also his patient testimonials, which, by the way, he just posted a new one on his Facebook page. If you haven't followed him yet, please do so. Live people having real results. And that's exactly it. He treats everyday people that walk through his practice in his clinic in Houston, Texas. He also lectures internationally around the world, both in person and online. He has his own podcast, and he also treats a lot of great famous Olympians around the world as well, a lot of gold medalists, a lot of famous boxers. Dr. Bob, you have been such a powerful voice of what we're looking for, which is truth. And sometimes it's not easy to hear, but we want truth. It's a noisy world out there. And this is the reason why we're doing our monthly calls is to have an intimate space. If there's questions that come to your mind, type them in the chat. This is an intimate sharing session to empower you. And with no further ado, Dr. Bob, I'm going to turn it over to you to share with us tonight.
He's the
And if
devil.
you're not muted, guys, I'm going to mute you guys in the background. Please mute yourselves. Thank you.
All right. Well, Diane, thank you always. And yeah, first, I'm an educator. I've taught doctors, as you said, all over the world for 30 years, over 10,000 hours of seminars. And I've had the joy of treating every category of patient from the elite professional athlete to critically ill and everything in between. And I've even done an international series on diabetes because the writing was on the walls. This is a problem that was going to destroy life, literally destroy the healthcare system. This was a cover story from a couple decades ago. And when I was in school nearly 4 decades ago, they used to talk about juvenile onset type 1 or diabetes, which was autoimmune attack on the pancreas. Now they call it type 1. And then they would call adult onset what they now call type 2. I'll show you in a moment. They now have defined 8 different types of diabetes. And the fastest demographic are actually young kids getting it. If you look at the causes of death from a medical standpoint, they still have heart disease, number 1, cancer, number 2. Believe it or not, they've got Alzheimer's way up there as well, and then diabetes. And I link those together because they actually call Alzheimer's a type 3 diabetes of the brain. But diabetes itself is more expensive than heart disease, more expensive than cancer. And if you throw in the contribution from Alzheimer's, it might be as more expensive than both of those combined. So here they list 8 different types: a type 1, a type 1.5, a type 2, a type 3, a type 3C, and things from there. It doesn't really matter that you know what they call these things, but they all relate to the body's inability to create insulin at the level that it needs to get sugar and nutrients into the cell. In this wonderful world of AI, people can get good answers to questions if they know how to ask the right question. And I asked AI to rate all the hormones in the body according to what was needed for survival. Insulin, the hormone that's associated with diabetes and prediabetes, is the number 1 hormone for survival, followed by cortisol, a chronic stress hormone, aldosterone, which regulates the mineral balance in the body, and then the thyroid hormones, and it goes down from there. So type 1 diabetes is an autoimmune attack. There's always some type of trigger. There's different types of strategies, but the triggers are usually a food or an infection. The infection could be a parasite, a yeast, a virus, bacteria. Here's the good news. People can put type 1 into remission. They talk about less than 1,000 people have done it around the world. But what I tell people, if it's been done nearly 1,000 times, if we get after years long enough, we might be able to reverse your type 1 diabetes as well. And then in the future, they actually have what they're calling allographic transplants, where they can literally take an organ from a different species. In this case, they took a pig heart, digested out the genetic material, then they grow that organ with the patient's own stem cells. And in the future, they're using the cells of the pancreas to make insulin. Hopefully, at some point, they will get there. And, in time, we may have a cure for type 1 diabetes. But prevention trumps cure. One of the main causes of type 1 diabetes is an infection of the cells of the pancreas to make insulin. A common infectious agent is the Epstein-Barr virus. In fact, they suggest that half of us are infected with that at all times. And when people have Ganoderma in their system, when they're infected with Epstein-Barr, even their pancreas infected, they don't get type 1 diabetes. That's absolutely critical. I've been promoting Ganoderma infused, reishi infused coffee for 14 years now, and they even have a cocoa for kids. I personally know of two people that, for whatever reason, decided not to go with the Ganoderma coffee and cocoa, and now they have a child that has type 1 diabetes. And the data is clear. If they were dosing Ganoderma consistently, they reduce their probability of getting it. We wouldn't say for sure they wouldn't, but they reduce the probability. Robert Lustig is a medical expert on diabetes, a medical expert on obesity. He was a pediatric endocrinologist. He's written a number of good books, and this is his most recent. And I like the title, I like the content, and I'm going to share some of the main points. But the title, Metabolical, is a play on two words: metabolism, or metabolic, and diabolical. So metabolism is what happens to food when you put it in your body. And he says diabolical is what happens to most food before it gets into our body. He says big food, big pharma, and even the federal government have essentially conspired to give us food that has very little nutritional value, lots of chemicals, and more or less promotes chronic illness rather than health. So he's got a number of podcasts, number of interviews, and the science is very, very clear. Insulin resistance or prediabetes is the most common factor and the most important factor that we can address in chronic disease, because it's associated with 70 to 90% of all chronic illnesses. So I asked AI to give me a consensus of the top medical experts in the world in diabetes. And this mostly agreed with my own, mostly agreed with Dr. Lustig's, but we're not fans of Ozempic, the GLP-1. That'd be Dr. Lustig and myself, and I'll tell you why. But the medical experts are in favor of that, so we'll talk about that and why. But number one, a healthy keto diet. Number two, good exercise. Number three, adding more fiber. Number four, they call it time-restricted eating. Other people would call it intermittent fasting. Number five, lose fat, not just weight, but lose fat. And we're going to find out if you lose muscle, that is bad for your future. And then we'll talk about Ozempic. That's a GLP-1 agonist, which 20 to 30% of the weight lost will be muscle. And then finally, the link between toxicity and diabetes. People later, if they want to screenshot that and read the references, they can. But the first thing is having an appropriate diet. And ketogenic means we're not getting any starches, any sugars. If we're going to do fruits, we'll do berries that have deep colors and don't raise the blood sugar. And by the way, when you eat food, if you eat anything that would raise blood sugar, if you have a little fat, a little protein, a little fiber beforehand, you actually will get less of a blood sugar rise. There are plenty of people out there that want to be vegan, so you can be vegan and eat keto. One of the easiest ways to stay keto is carnivore, even though we're not carnivores. We're actually omnivores. So we're not vegan. We're not carnivores. We're omnivores. We should eat plants and animals. But this was a big study done out of Harvard. Over 2,000 participants. Basically, they were all very severe diabetic, taking insulin. 92% of these people were able to get off of insulin with 6 months on a carnivore type diet. Very, very powerful there. and a number of improvements, including 90% improvement across the board with all diseases. When it comes to moving right, there are half a dozen really well-defined mechanisms by which movement will reduce blood sugar and enhance insulin. But here's the simple fact: when you contract your muscles will eat sugar independent of insulin. It does not take any insulin at all to get sugar into a contracting muscle. Now, both aerobic and anaerobic exercise work, and they do it by increasing different factors that will affect the whole body. They increase mitochondrial efficiency, that's where fat burning occurs, and they even increase the number of glucose transporters. So, interestingly enough, more and stronger muscle contractions will lower blood glucose faster. So, somewhere on my YouTube channel, you can find this woman, Pat Odom. The very first day I saw her, 5 foot 4, 248 pounds, taking 8 different drugs. Kidney function was on the decline. She told her doctor she was worried that she was going into kidney failure. And he looked at her, he said, that's okay. That's what dialysis is for. Well, if you've ever studied dialysis, that's not a good thing. Your kidneys don't work. You have to rely on an external filter to clean your blood, and you do that 3 times a week. And about the longest anybody lives after they start dialysis is 5 years. You can look all that up in the medical facts. So they're on their way down. 9 months later, we had her 38 pounds lighter, not taking any drugs, totally had her non-diabetic, off of medication, and even completely reversed her kidney dysfunction. And we did that with diet, nutrition, and exercise. But the reason I show Pat is literally we asked her to contract her muscles every single day, which she would do whole body as much as she could. And within a matter of days, she was able to normalize her blood sugar just with better activity. Mitochondria make 94.4% of human energy when they work well. Intense exercise will increase the efficiency of the mitochondria, whereas more exercise will increase the efficiency of mitochondria. Fiber is basically non-digestible parts of plants. All plants have some level of fiber. They actually suggest that we should do between 40 and 50 grams a day of fiber. Fiber is not digested by us, but it is digested by the bugs in our gut. And when you get the right fiber for you, your bugs will make very healthy compounds from that, and you will also have good bowel function. Now we're going to talk about what they're calling time-restricted feeding. That's what that TRF stands for. And in this case, they had them on a pretty tight window. They started eating at 8 a.m. and stopped at 2, so that was only a 6-hour window. What I can tell you is if you have the worst genes, that's the window you need to get the maximum benefits from intermittent fasting. If you have the best genes, you still need 14 hours of fasting. But so many different things work. Insulin goes down, insulin signal function improves, the pancreas improves, blood pressure drops, appetite drops, lots of things begin to move in the right direction. And this gentleman here won a Nobel Prize in 2016 when he determined that when the body is in a fasting state, when it's hungry and when it needs to feed on itself, the first cell it eats are dead and dying cells, precancer cells and cancer cells. You start looking at the benefits of time-restricted eating, body composition, overall health, diabetes prevention, diabetes reversal, cancer prevention, anti-aging, all really good responses. You probably heard early in your life that you should eat breakfast like a king and let the values go down. Well, now that they've been able to study the organ synchronization and our body rhythm, they found that that's exactly right. A bigger breakfast, a smaller lunch, and the smallest dinner, stopping 3 hours before bed, is best. And then for people that are doctors and want to look at all the things that improve with proper circadian eating, you begin to realize that that is a strategy that can get you a better and longer life. When we start talking about body composition, for every 1% body fat loss, your risk of diabetes goes down by a little over 2%. So when it comes to eating, if you train hard, exercise hard, contract your muscles hard, you can earn some carbs. And then always, if you're going to eat carbs, eat them and buffer them with quality fats and proteins. So simple carbs, absolutely only after intense physical exercise. Um, or people that want dessert, it's said that a sugary snack is not okay, but dessert is because you have all the other food, fiber, protein, fat to buffer the rate of the sugar getting into the system. So, if we were going to rate the blood sugar response from worst to best, simple sugars followed by complex carbohydrates followed by protein is going to raise blood sugar. Stress will do it. Sleep, lack of sleep really will raise blood sugar. Exercise can. Dietary fat, almost not at all. Now, this graph is pretty fascinating because we're talking about the metabolic health of people. In our society, less than 2% of the population is underweight, but believe it or not, only 50% of those patients that are underweight are metabolically healthy. Of those that are considered ideal weight, only one third are metabolically healthy. When they're overweight but not obese, 25% are metabolically healthy. By the time they get to obese, it's almost 99.5% are not metabolically healthy. But there are people, they call them thin inside, fat outside, or fat outside, thin inside. They actually can be metabolically healthy. Morbidly obese, almost nobody. So if you're going to have body fat, you actually don't want to have organ fat or visceral fat. You want to actually have what's called subcutaneous fat. Now, when the body starts storing fat where it shouldn't, the first place that it tends to go in most people is liver, followed by muscle, followed by the pancreas, followed by the heart, followed by the kidneys. And keep in mind, we don't want the liver getting fatty because it is the organ that gets most blood flow at rest. So filtering the blood is very important. Kidneys get the second most blood flow at rest. They also filter the blood. So fatty liver is associated with all kinds of ill health conditions, including high blood pressure and diabetes. Fatty muscle, that's associated with pain, fatigue, things like fibromyalgia, and it certainly can set you up for high blood pressure and diabetes. Fatty pancreas will disrupt the digestive portion of the pancreas and the insulin portion of the pancreas. If your heart becomes fatty, it doesn't function anywhere near as efficiently, and that'll give you fatigue and potentially set you up for a heart attack or stroke. And finally, when the kidneys get fat, they don't filter the blood effectively, and that can be a cause of high blood pressure. So this is Dr. Peter Attia. And people ask him, hey, what do you think about that miracle weight loss drug, Ozempic? And he says people lose 30 to 40% of lean tissue, and that is not good. And Ozempic can also block your ability to perceive pleasure from other things in life that would normally be pleasurable. Crazy enough, these drugs seem to be taking over the world by storm. Breaking down lean tissue is a problem, and it's actually estimated that just the side effects from these drugs will cost about $57 billion a year. And most recently, we've learned that statins, the drugs that medicine gives to lower cholesterol, infects GLP-1 or affects GLP-1 in a negative way, and therefore can make it so that it's easier for you to gain weight. There are a number of natural strategies to improve GLP-1. They do not work anywhere near as well as the drug, but together, when we eat right, drink right, think right, move right, sleep right, poop right, talk right every single day, we can make diabetes go away. So we do have a toxic world. Anywhere from about 1 in 5 to 1 in 8 problems in our world are associated with the toxins. And we know that certain toxins cause gain of body fat. They can also cause neurologic disorders, diabetes, and set people up for cancer. And we know as people gain weight, it's a risk factor for nearly everything. And in fact, it is the number 2 risk factor for cancer. There's a whole new category of chemical called obesogens. This started, defining these around the 1990s, but there are literally thousands of chemicals in the environment that will disrupt mitochondria. That's where energy is made and fat is burned. So I happened to lecture at a conference with these two ladies a few years ago, and I love this quote: "Don't count calories, do count chemicals." Human toxin inventory shows that everybody has about 700 toxins in their system at all times. It's responsible for 1/4 of all health challenges. The symptoms of chronic poisoning, fatigue, sleep disturbance, intestinal distress, allergy symptoms, headaches, confusion, and anxiety, and the link between toxins in the environment and diabetes matches perfectly. And the number GGT is an indicator of toxin clearance within the body. As that number goes up, indicating the body needs to clear more toxins, so does diabetes. And certain pesticides and heavy metals also increase the risk of diabetes and other problems. And this is a problem because we are all exposed to these every single day. So we want to be able to clear these from the body. Finally, glyphosate, something that's banned in Europe. We use a lot of it in North America. It's been proven to be linked to autism and to type 2 diabetes. So everybody walking around has 700 toxins in their body. I recommend an intense detox a couple times a year where they do all organic foods and specialized nutrients. And what I tell people is when they actually do an intense detox, they can achieve a lot more than if they didn't do it that way. Diane mentioned I put something on my Facebook page today. I had a woman come in just a few weeks ago, was absolutely miserable, going through menopauses, hot flashes, sweating all day, all night long, not sleeping, gaining weight, no energy, you name it, all the symptoms that people don't like. We put her on a 2-week stress, 10-day stress reset and detox. And 4 days in, she thought she was just miserable. Oh my God, I can't take this. But then she turned the corner. And by the way, that can happen. Sometimes you have to take a few steps backward before you go forward. Now she feels brand new. So with that said, let's answer any and all questions you might have about diabetes first or any other health topic.
Thank you, Dr. Bob. We do have a question in the chat while people are gathering their thoughts. Is diabetes related to high blood pressure?
Absolutely. Not always, but most of the time. So, one, diabetes is associated with increased fat. Every time you gain fat, you have to increase the amount of blood vessels in your system. When you gain visceral fat, when you gain liver fat, when you gain kidney fat, then you start compressing the critical blood vessels, and the body has to elevate the blood pressure in order to filter it. So, fatty liver, fatty kidney, visceral fat, all known as triggers of high blood pressure. Excess body fat, also a trigger, and even insulin resistance by multiple mechanisms contributes to high blood pressure. So, if we make insulin better, we often make the blood pressure better.
Thank you, Dr. Bob. We have another question. Do we have long-term studies showing effectiveness and sustainability of keto diets?
Oh yeah. And so well over 100 years, because one of the things they started studying keto diets on, it was more or less by accident, they found it very effective for seizure control. So there are certain kids that have some type of seizure disorder. 100 years ago, they didn't have much to offer in terms of medications, but they found out that 1/3 of people with seizures would be seizure free just on a ketogenic diet. So there are plenty of people that have done keto for their entire life. And as Robert Lustig would say, I'm not an advocate of vegan. I'm not a fan of low carb. I'm not a fan of carnivore. I'm not a fan of whatever. But he is a fan of not spiking blood sugar, and that essentially is keto. So a healthy diet, if God made it, it's okay. If man made it, stay away. If you don't get too many simple starches and sugars, your body will likely thank you with a fitter, leaner, longer living, better functioning body.
Amazing. Thank you, Dr. Bob. And the next question, is the 7 to 10 day detox just a meal plan of clean eating, or do you have a specific program to follow?
Well, detox is nutrient dependent, energy dependent, protein dependent. And if people were getting what they needed from their food, well, they would detox all the time. Now, keep in mind, most people are going to make better food choices when they're detoxing, but I have used targeted nutrition for over 3 decades, whether it's medical foods or certain supplements, the more we know about the patient, the better recommendation we can make. But some of these medical foods, one, to be a medical food, you have to be proven. Well, I'll give the four criteria: guaranteed potency, guaranteed purity, proven effectiveness in human clinical trial, with every nutrient recognized as safe. So, if you get a medical food, you have to get it through a practitioner. The nutrients are safe. I feel pretty good about that, but it's best to work with someone if you, especially if you're dealing with a health challenge.
Thank you, Dr. Bob. Next question. How is diabetes and hemochromatosis, along with an increased hemoglobin A1C, correlated?
Well, hemochromatosis is a problem clearing iron, and it turns out to be a liver problem. It could be hereditary, but some people just with diabetes, the compromised liver, remember the fatty liver is usually the first place that tissue becomes dysfunctional. 75% of people, when they gain excess fat, will get fatty liver. That starts compromising liver. So the diabetes can compromise the liver and cause the hemochromatosis simultaneously. Hemoglobin A1C, that's just a measure of the 120-day average of blood sugar. And what's interesting is it's what's known as glycated hemoglobin. I met a young lady that was so anemic this last weekend. She was having such heavy menstrual cycles. She had so few red cells that her hemoglobin A1C was very low, even though there was every indication that she was full-blown diabetic. But your red cells have to last long enough to test. So there's always confounding variables. By the way, in that case, what I recommended was something called a fructosamine test, glycated albumin. That's only a 10-day average, but it wouldn't be affected by anemia. So the interesting thing is we need to know all values, or it's helpful to know all values to put together the right program for the person. In that person's case, not only they were diabetic, but they were, having severe menstrual bleeding, probably uterine fibroids, lots of things we needed to fix first or simultaneously.
And in that same question, Dr. Bob, she wrote DM2. So that would be increased hemoglobin A1C correlated DM2.
Well, I believe what DM2 is, the reference is diabetes mellitus type 2. Yeah, and absolutely, that is the criteria, right? If you have a spike of blood sugar, that's probably insulin resistance and an inappropriate meal. But when hemoglobin A1C is elevated, that's a pure indicator that you've been, if it's above that 6.5, you've been type 2 diabetic for likely 120 days or more.
Okay, perfect. Thank you, Dr. Bob. If you have any more questions, feel free to type them in chat. You can also unmute yourself if you'd like to. And for the record, if anyone is curious, and I get this question a lot, Dr. Bob Rakowski does do virtual appointments. So even though he's in Houston, Texas, heck, I'll tell you right now, I have flown down to his clinic. I will do all the testing that he does. It's all around prevention. I'm a big fan of prevention, seeing where I'm at. But if you don't have the luxury of flying down and you want a virtual appointment, you can definitely arrange for that. Dr. Bob is the Natural Medicine Center, and reach out to the person that invited you to this call. We can definitely connect you if that's something you're looking for. And the next question here is, what is the Facebook group to join Dr. Bob?
Oh boy. Well, I've got my own Facebook page, but our community here is called OG Global Go Diamond. And so, Diane, if you can put a link in the chat, that's a good way for all of us to stay together. And I see Mr. Claudio has his hand up. So happy, beautiful evening, Claudio.
Of course, and same to you. Thank you for all the information. I have a few people that have asked me periodically the mocha, the hot cocoa, the latte, with all the sugar, all the cane sugar that's in there. How good or how bad? Can you explain why it doesn't affect the sugar and the insulin spikes, please?
Well, not only is there sugar in there, but lots of things that buffer sugar and help the pancreas. And Ganoderma itself has 6 different anti-diabetic mechanisms, helping the cells of the pancreas, modulating insulin release, helping insulin respond at the level of the cell, influencing a series of kinases within the cell, serving to buffer the oxidative effects. So what I recommend to everybody is they need to know how everything works in their body. Now there's a continuous blood glucose monitor. If people can get it, they could actually drink one of our sugar beverages like a mocha and see what happens. And that was one of the best experiments we ever did. I was giving a lecture for a group in Toronto, Canada with Sachin Patel's Perfect Practice. about 100 doctors in attendance, and I was lecturing about Ganoderma, the health benefits. And Sachin said, "Well, Bob, we're going to throw you a little curveball. What I'd like to do is have someone in the audience put on a continuous blood glucose monitor and drink a mocha, and let's see what happened." So it wasn't your typical patient. It was a 35-year-old healthy, fit male. He drank a mocha with a continuous blood glucose monitor. And over the course of 2 hours, his sugar didn't go up hardly at all, just like a meal of broccoli and chicken. And in that room, there was a bunch of doctors that probably hadn't had sugar in years. And they said, "Oh my gosh, if this is blood sugar friendly, I want some." And sure enough, we sold out of all the mocha, and a bunch of people signed up to share the treasures of the earth with the people of the earth. So I tell people, get a test before and after, especially if you're diabetic. It's tested so far. Everybody that I've tested, it's tested really well. But guess what? Someone may be extreme, and at this point in time, it might not be good for them. We want to know. But in time, I believe everybody could have this.
I've actually had my events. I've had people with their glucose monitor on their arm challenge me on it. And you know what I said? Please, you know what? If you see it spike, the coffee's on me. If you don't, then you know what? You're going to have to pay me for it.
Yep.
And one sip, two sips, three sips, 2 or 3 basis points drop while they're standing right in front of me. So case proven right away. So I
Yeah.
don't I don't have a challenge with that anymore. So
Well, I'll
and
tell you what,
what kind
I wish everybody had a blood glucose monitor because hey, we'd prove it pretty quick, wouldn't we?
can we purchase them?
With a prescription. It's interesting. I don't know why that wouldn't be readily available to everybody. I think anybody can go into a pharmacy and buy a finger prick, right? That's easy because diabetes is such a big problem. But, I guess there's a risk of long-term infection. I could see a justification for that being a prescription item. But I'd like people to have the data. What they're trying to come up with, Claudio, is there are some sensors like my ring sensor that they're saying are very close to being able to sense blood glucose. So maybe we have that in a year without having to break the skin.
Wonderful. Thank
Yeah,
you.
that'd be awesome. You're welcome.
That would be amazing. And that's exactly it. So if you're kind of curious about Claudio's comments and you haven't had access to the Reishi infused beverages that Dr. Bob has made reference to, and you heard Claudio's story, please connect to whoever invited you. If the person that invited you is not on this call or you don't know how to access them, you will get a thank you email for registering. You'll get the replay for 48 hours. And in there, there's a space where you can connect with us. I will get that message directly and connect you with whatever it is you need, whatever questions you may have. We have a beautiful community that is here to support so much goodness, so much goodness. It's been a beautiful I'd say ride because ever since we started having these beautiful calls and the community that comes together, it's wonderful. If you're in the Toronto area, Dr. Bob Rakowski will be back in November 6th through the 9th. We'll be having events all around the GTA in the city as well. So you can come meet him and be up close and personal, which is very exciting. And really, we need this. Right now, there's just so much noise out there. You need a trusted source with published medical journals, with a huge following that has been a trusted source in the circuit of the wellness space for decades. And that's exactly it. So this is the reason why we have these community conversations. And there will be one next month as well. So any other questions before we close out for the evening? I'm going to check my here. Oh, Gosia, love the comment. I love Organo Coffee. Thank you for the presentation. Thank you for coming, Gosia. And Alice is here as well. We met Gosia at a live event. I'm so happy that you've been open and connected because this is exactly it, right? Many of you are doing other modalities. Well, what if you just switched a better cup of coffee, knowing that 60% of there has mold in it? You need something that's certified pure that is going to support all the pathways, inflammation, sleep quality, blood sugar, you name it. When you feed your body right, it knows what to do. It is Mother Nature's intelligence, and that will never, ever, ever, ever change. I just saw you make a comment, Dr. Paul. Can we comment on green tea and the effects on carb metabolism? Great question.
Well, green tea has its own blend of nutrients, and they call them, epicatechin, galates, and things like that. Good for liver, good for pancreas, good for immune system. There's at least 1,000 studies on the health benefits of green tea. And some of those are insulin signaling, antioxidant, liver function, detoxification, blood pressure, immunity. So I'm a huge fan. And guess what? Our green tea is infused with Ganoderma. Ah,
Fantastic.
Dr. Paul's drinking one now. Well done.
Ah,
And
uh,
Delina as well.
Sometimes I think you're a filing cabinet, Dr. Bob, that you just pull it out and pull up a file and it's well done. Thank you for your time.
You're
Mm.
welcome.
Wonderful.
Appreciate you.
Well, thank you, everyone. I will get green tea for sure. Yes, Gosia. Actually, you know what? If you're looking for something in the evening, I love green tea. And I know many people are big coffee drinkers. Funny enough, I'm not. However, I fell in love with their mocha. Thank you, Claudio, for bringing that up tonight because I too am blood sugar sensitive, but this is my treat that I don't have to worry about. And it's been a joy and my green tea, which I absolutely love. Claudio, you have your hand raised. Do you want to make another comment?
Dr. Paul just actually triggered another question, actually. So I do the green tea with the red rooibos, which has got a naturally anti-inflammatory in there as well. So combine them together in a tea kettle with 1.7 liters of water. You'd think you'd reap on more benefits that way as well. Am I correct to say that? I've been doing that since day one.
Well, the red tea also has the cordyceps in it, which is so good, right? And there's people that just love the blend. So yeah, cold brewing it the night before. I think I got that idea from you. Shared it with lots of patients. People that do it love it.
I love it. Well, thank you, Dr. Bob. Next month, we will have Dr. Bob again, different topics every month, but it doesn't mean you can't ask questions. If you're watching this replay, join us live. This is your opportunity to ask your questions in the chat, and they are open. It's just amazing all the knowledge that comes out of your mouth, Dr. Bob. And I'm always making notes, always. As a practitioner, I'm always learning the latest. I know you do the research, I know you bring in the science. I take screenshots because I too like to be up to date with real information. Tammy, the replay will come to you digitally. Once the VAs get the recording, it'll go out tomorrow and it'll be available for 48 hours only. And then we pull it. We just figure, you know what? People are in or they're out. If not, they can catch the next one. And we're just going to get better at providing value and making this as seamless as possible. So it was lovely seeing some beautiful faces and some new faces. Juana, Angie, Alice, Tammy, Gosia, Eric. Eric's another big follower of Dr. Bob, another practitioner, Grace, Claudio, Delina, Dr. Paul. Lovely seeing everyone here tonight. Have an amazing evening, everyone. Thank you for being on the call. Be that beam of light out there. Spread the information. The world changes when we change, and the best way to lead is to lead by example. With that being said, happy night, everyone. Thank you for everything, and we'll see you on the next call. Good night. Good night.
Thank you, Dr. Bob.
Thank you.